to talk about BFR, blood flow restriction. And for those who haven't been certified, we should probably get you to a course. But anyway, so things I found. I'll give you some cases which then have made me think that sometimes you're going to get the positive healing without using healing. So how does that happen? Okay, I had a guy, total knee replacement in Florida, 7 weeks of physical therapy. He comes up here because he's a snowbird, and he says, Fran, just want you to know, I have the same pain in my knee I had before I had the surgery, and I have no strength in my knee. So that was a red flag, and I thought, wow, BFR, I'll do BFR. He was one of my first patients, actually. So I started doing BFR with knee extension on the NK, just the bar, which is approximately 3 pounds. So I was looking to improve his strength, to be honest. So I was doing strengthening. And we did it. And then we did it the next time. And then the next time. And then the fourth time he comes in, he says, my pain's gone in my knee. He goes, that's amazing. And then I was like, yeah, right. Anyway, the pain never came back. So that was after 3, and he was like 72, healthy though, very, very healthy. He, after 3 strengthening of knee extension. So then I started thinking, wow, maybe you could just get rid of pain doing strengthening and not have to do the healing. And then we got his strength through doing knee extension. We didn't do leg press. So then I started thinking, we have some people that the strengthening isn't helping the pain. So then I go, maybe I gotta do this stupid healing thing, because that's 25 minutes. You're like, ugh. So then I started doing strengthening and ending with healing, which I know is time consuming. And then some of them said, holy shoot, that's helping my pain. So then I'm like, oh, yuck. I gotta do strengthening and healing. And then I had a chronic case that I thought he needs every day. I think this isn't gonna give him his greatest impact. Nobody knows what his problem is. So I said daily. I think we did daily for 3 weeks and did charge him 1.7. And all we did was healing. Felt a lot, actually we did. We did one exercise as well. Strengthening hip flexion exercise.
What was his pain like?
His pain was excruciating here, here, and here. They said it's not his hip. Yeah, it was a tough case. Anyway, then he did great, and then we let him go, and then he was gone, and he came back 7 months later, complaining of the same thing. And the doctors all looked at him, specialists, and they're like, they don't know. So we started him on it again, and he's way better. Yeah, but so I think they have something in this blood flow restriction. So I use it for ACLs early because I can start getting the strength without putting stress on it. I'll do hamstring work on those guys right at the blocks, and hip work, rotator cuffs I'm doing it with. So I can do eccentrics with them, with the cuff on. Yeah, I'm just always trying to push the envelope. So I'm trying to get the strength quicker if I can, without compromising the repair. I mean, you're not gonna throw your rules out the window. But yeah, so I use it for strengthening, especially people my age, total knees. I mean, who can't do high intensity training maybe. And yet you can still get that strength. But I still make them do an exercise at home, whether it's knee extension that doesn't hurt them, or wall squats, or, you know, I have people do eccentrics with the quad, the ACL people. So I have this is the ACL leg. They go down and then push up and down. So they're doing 30, 15, 15, 15. So, I mean, because if they have trouble with the leg press and it's compromising, they feel compromised, well then I can do it right there. And for some reason, the 150 on leg press, the person 150, they feel the pain in the ACL out here, and they do this and they don't. And I got to get the strength. So I'm just more imaginative, I think, now that I know I have this ability to strengthen people without compromising their joint or stressing it intensely. Yeah.
And then there's some really tricky cases you said where you'll do BFR daily healing.
Right. Yeah, daily. Yeah, that's like that guy every day. Yeah, well, I have 2 people right now. They're in their total knee 2 years ago. He's got terrible pain, can't strengthen it. He just can't because of the pain. And stairs are killing him. So I tried strengthening with the BFR like 3 visits, 4 visits, and then I said, screw this. You got to come in every day. Let's give it 3 weeks every day. 2 days will be the legits.
Is that because it was helping the short term?
Yeah, he was saying this, it's feeling better for a little bit.
Oh, and then it goes
like an hour.
So you said one every day.
So then I'm like, every day, forget it. Yeah. And now I'm making up this protocol. So, you know.
Have you had any success using BFR healing for nerve issues?
Well, I haven't used them.
Okay.
Yeah. But if I were to do it now, so I'm getting different with the BFR. If it's a chronic case or a nerve case, and I can't get it with the scarring, then I would say to someone, I'm bringing you in 5 days a week. I'm going to charge you for 2 of those 5, and then I'm just going to bring you in to get healing. And that's it. And I would do it 5 days a week. And if I'm coming in Saturday, I'll do it Saturday. Because the BFR, when it's a tough case and you don't understand it, or you really do get results like traction, like daily. You can help someone somehow better. If you do it twice, you don't get the positive result. But if you do it daily, you know, 2-3 weeks. Remember those guys in that limb salvage program were getting it twice a day.
Oh wow.
For healing. So yeah, I'm starting to think more like, if I have a chronic case and I can't solve the problem and I don't want them to do, or they don't want surgery, I think I'm being unfair if I don't give them at least 2 to 3 weeks of 5 days a week of that for me. So I'm actually doing my own study on this for tough cases. So that ulnar I would try, but I would say, are you willing to try 5? But they got to be really worried.
Yeah.
Yeah, to do that.